Let me start by, first of all, thanking the Health Foundation of Western and Central New York, certainly the National Association of County and City Health Officials, and most important and very dear to our community, the State Health Department, because they've recognized the importance of breastfeeding-friendly medical practices, and they're providing the financial support to continue the expansion of such an important service in Erie County. This community is very fortunate to have a very active and important coalition. It's called the Healthy Start, Healthy Future for All Coalition. The vision is essentially that all children in Erie County have a healthy start and are prepared to grow, thrive, be healthy, and give back to the community. The coalition is actually a network of healthcare organizations, medical providers, school-based and university organizations, government entities, human service organizations, and faith-based partners. They're committed to strengthening the systems and community supports that promote maternal, infant, and child health. The purpose of the coalition is to develop a coordinated and effective medical and public health system that eliminates disparities and improves health outcomes for the most vulnerable populations in Buffalo and Erie County. The coalition is led by the United Way and UBMD. Dr. Steve Turkovich, who many of you know, the Chief Medical Officer at Kaleida, as well as Dr. Faye Justicia Lindy, OBGYN, University Gynecology and Obstetrics. They're both co-chairs of this coalition, and we're very fortunate to have their leadership. The coalition partners work collaboratively and coordinate pre- and postnatal supports, active lifestyles and nutrition supports for preschool and elementary school age children, and improve family engagement opportunities. The coalition was the foundation from which Breastfeeding Friendly Erie County Initiative was built upon. The activities of 14 coalition members were coordinated to enhance and strengthen the existing community support system. Coalition members have helped shape the implementation of multiple evidence-based interventions in healthcare practices and hospitals, child care settings, home visiting programs, work sites, and faith-based and community-based organizations. Since 2010, the Healthy Start Coalition has successfully influenced behaviors, practices, programs, and policies within these settings to improve health outcomes for our families. The coalition activities align with our United Way Community Impact Platform priorities, which include improving health by promoting healthy behaviors and choices and increasing access to needed care and services. In addition to supporting the coalition, the United Way, as you probably know, invests funds in programs that improve maternal, infant, and child health and ensure older adults live healthier lives and access needed services. Recently, I want to highlight the important work of the coalition. We were recognized by the Robert Wood Foundation through a video launching the 5th Annual County Health Rankings and Roadmaps. The video highlighted 9 successful coalitions addressing health concerns at a population level using county health rankings as planning platform. Finally, let me take this opportunity to thank the leadership of P2 Collaborative, Dr. John Fadima, who you're going to hear from shortly, and I know you're going to hear from Dr. Young as well. Their involvement, the collaborative's involvement, has been unwavering, and their partnership and support has been very significant on this important topic. And I would be remiss if I don't recognize our friend and partner, the Health Commissioner, Gail Burstein. Gail has been actively involved in the work of the coalition and has provided invaluable contributions to our community efforts to enhance breastfeeding practices in Erie County. So thank you for having me. This has been really important work for our community.
As with Mike, I haven't had any first-hand experience with breastfeeding, but I do have a lot of second-hand experience. My wife breastfed all 3 of our daughters, and in turn, all of our daughters have breastfed their babies as well. I have 4 grandchildren, all breastfed, so firm believer in it. The health benefits of breastfeeding, especially exclusive breastfeeding for the first 3 months of an infant's life, and continued breastfeeding to 12 months, imparts powerful healthcare benefits not only to the infants but also to the mothers. This is both short-term and long-term. Infants are protected from acute illnesses in the first year of life. Parents of breastfed infants miss less work because their infants have less illnesses during their first year. Breastfed infants also have a lower incidence of sudden infant death syndrome, which is well documented. In the long term, breastfeeding protects the mothers against both ovarian and breast carcinomas. It also protects the children as far as chronic diseases go, looking at obesity, type 2 diabetes, and even childhood leukemias, both acute myelogenous and acute lymphocytic leukemias. Again, well documented. For these reasons, in 2012, the Centers for Disease Control and Prevention funded 6 states to develop community, peer, and professional support systems for breastfeeding. Unlike the 5 other states, New York State decided to break from that and develop a focus group we picked Buffalo and Erie County. Reason being was the high incidence and need in our community for breastfeeding, but also because of significant work already done by the P2 Collaborative of Western New York and the United Way of Buffalo and Erie County to develop and support an infrastructure that promoted breastfeeding among women of color in Erie County. 12 community agencies initially received funding to conduct this work. Today, Erie County continues this work and boasts a network of collaborating community agencies, breastfeeding-friendly primary care medical practices, breastfeeding-friendly daycare home and centers, and a unique network of baby cafes to provide drop-in peer and professional breastfeeding support at no charge to individuals. What has been done in Erie County is so successful, we at the state are looking forward to the day when this is expanded to other counties in the state and other states in our union. Thank you.
Thanks. Good morning, everyone. And it's great to be standing here today to recognize the great work that's being done to promote breastfeeding and its many health benefits in our community. So in collaboration with United Way and P2 Collaborative, the Erie County Department of Health is taking a leading role to improve the health of newborns and new mothers in our county. I'm proud to say that the very first pediatric primary care and women's health practices to be receiving the New York State Health Department's breastfeeding friendly designation are right here in Erie County. And I'm also proud that one of them is my pediatrician's office. So these 14 practices have adopted recommending breastfeeding support to steer mothers away from formula and towards the proven health benefits of breastfeeding. So as a pediatrician and a mother, I know that breast milk has a perfect blend of fat, sugar, water, and protein to promote growth and healthy development. Unlike formula, breast milk helps protect babies from infections, reduces the risk of allergies, and even reduces the risk of obesity throughout childhood. So by encouraging breastfeeding exclusively for the first 3 months of life, our breastfeeding-friendly practices are giving babies a leg up on the start of their lives. So outside the doctor's offices, community-based baby cafes help provide free access to peer and professional breastfeeding support. So this initiative is a great example of what we can accomplish through collaborations with organizations like United Way and P2, and I look forward to many more partnerships to come. So when I was a new mom in Baltimore, Maryland, I really struggled to be successful with breastfeeding. I know firsthand the support of these OBGYN offices and pediatric primary care offices here today are providing their new moms and babies is really greatly needed throughout our community. And so before I turn the podium over, I also want to acknowledge Cheryl Moore. There's Cheryl. Hi. From the Department of Health, who did an outstanding job leading this effort. So thank you.
Good morning, everyone. It's my privilege and honor to be here today to represent P2 Collaborative. As you know, the P2 Collaborative of Western New York works to improve the health of Western New York residents. It is through this commitment that the P2 Collaborative drives innovations in health and healthcare in Western New York as a convener of individual consumers, community-based organizations, primary care practices, hospitals, and health plans. The P2 Collaborative worked closely with the New York State Department of Health and the United Way of Buffalo and Erie County to recruit, train, and provide technical assistance to local OBGYN and pediatric practices to facilitate their achievement of the New York State Department of Health breastfeeding friendly practice designation. Although this initiative was open to all local OBGYN practices and pediatric practices, special attention was given to the Medicaid-eligible women and their children. This was an effort to address the health disparities low-income families experience in our local community. The grant objectives required that at least 5 primary care practices achieve the designation. Today we are honoring 14 practices because of their efforts to attain this critical designation, and 2 more practices are close to achieving the designation in the near future. By collaborating with the United Way and the Healthy Start Coalition, we far exceeded the grant goals and greatly expanded our community's ability to improve the health of women and children. I want to personally thank Julie Lulek, who coordinated this effort on behalf of P2, and Suzanne Aquilina, a local pediatric nurse practitioner and international board-certified lactation consultant, who trained medical personnel on the evidence supporting breastfeeding benefits and best practices. They work tirelessly to support medical providers in meeting the designation standards. So thank you, Julie and Suzanne. You're welcome.
Has Kathleen joined us?
Yes.
Mom.
Can you come over?
Sure. Maybe friendly office.
Hi, I'm Kathleen Holt and this is Corbin. I go by Katie. I obviously am one of the mothers that goes to Baby Cafe with OBGYN Associates of Western New York. He is 7 months old now and a happily breastfed baby. He actually just had a snack just a minute ago. As a new mom, I really didn't know what I was doing, but all I knew was I wanted to breastfeed. My mom breastfed all of my siblings and I, and it was really important to me to be able to do that. And even though we had to go and use shields and we struggled at first, like all new moms do, it was really nice to have the support of the Baby Cafe. And even though we're not struggling anymore, it's a really nice community and I love going to it. And he loves the interaction with the babies too. He's the star of the show.
I believe he's the star of today's show.